Hello everyone, I'm Victor. Today I'm going to talk about career choice and what I learned from the preceptorship program. As high school students stepping into a senior year, conversations about future career began to increase significantly. People you are familiar with start to ask about your college major, and people you don't know, you met for the first time, they also ask the same question about what you want to do after knowing that you're going to be a senior. You have no answers to those questions, and you believe that there's still plenty of time for you to figure out. For about a month, that same question stuck inside my head, and I wondered, what do I want to do? As those questions asked again and again, a little sense of panic started to rise up in everyone's heart. Maybe it's about coping with the panic, or maybe it's about constructing an official answer for that question. I decided to be a psychiatrist. The doctor for treating the psychotic disease and what others call a shrink. Hoping to see some real practice done by a psychiatrist, I joined the Kaiser medical program. However, I was told at the last minute that the mental health department is not open for preceptorship due to the confidentiality. To be honest, I was very frustrated when I first received that news. Without a mental health department in my rotation, it's like missing a main course in a 7-course dinner. Before the summer, my understanding about hospital remains as doctors and nurses. Since I don't see myself nursing people or treating other people with surgery, I couldn't raise any interest for this program. However, Kaiser Hospital really surprised me with the variety of their workers and working places. In a clinical lab, the lab scientists test the blood sample and construct computer image for doctors. Lab assistants then read the lab and label those images for the doctor to make a better diagnosis. In pathology, it's like a small factory. Pathologist assistants examine and make reports for tissue removed from the surgery room. Pathology technicians operate machines to make microscopic slides for pathologists to observe. And in radiology, it's like a studio. Pathology technicians operate machines to make pictures for radiology just to make a final conclusion. They use CT, MRI, X-ray, or ultrasound, trying to provide the best image they can for the doctor and the patient. I was fascinated by the incredible amount of job opportunity in the hospital and realized that in the hospital, everyone can use their talents to help patients. If doctor is the brain of the hospital, then other workers becomes hands, eyes, and ears, providing vital image for the brain to make a correct judgment. I believe a lot of people sitting here has already got a scene of what they want to do in the future. And that's awesome. There are still thousands of different jobs out there, and as we learn more knowledge during our education path, more and more will become available to us. Let's work towards the goal we have right now, but at the same time, have an open mind to different possibilities in the future. Thank you.